In this video, I'm going to talk a little bit about maintenance treatment and how using regular treatment can actually really help keep you healthy, keep you well. And patients often ask, hey, do you do the treatment? Or they're shocked when I say, yeah, I'm on the table a couple of times a week to just make sure I'm looking after myself. Fundamentally, why are we doing that? What is the treatment doing? You've got the vibration work, which is fantastic. That's helping keep those muscles nice and limber, nice and loose, so they're effective. They're good exchange of oxygen in those muscles. They're not stuck and bound, and also they're keeping the hip joints, the knee joints, etc., and the back joints nice and free, nice and mobile. And that's fantastic to do after a workout. And I'm working out regularly. Obviously, we have to keep ourselves in good condition so we can treat you, the patients, and that's a real help, especially when you're sort of asymptomatic. Then you've got the decompression. Decompression is awesome. Every day we're weight bearing, we're loading on our spine, and if you've seen any of our other videos, you'll know that most of these back problems are caused by repetitive stress and compression of the lumbar spine if we're talking about the lower back. And that happens on a day in, day out basis. Whether you're sat at the desk every day, answering emails, on the phone, doing your word processing or coding or whatever it may be, or whether you're sat traveling long distances, airplanes, etc. All that stuff puts extra pressure on your spine on a daily basis, and it makes sense to go on that decompression table, take that pressure off your spine, and it just really helps get that exchange of nutrients in and out of those discs so that something doesn't build up and become a problem later. It's just being sort of careful, if you will. And I'm going to the gym regularly personally, and so the other guys here are as well. And actually, if you're doing any things like deadlifts or squats or other physical exercises, having that decompression done on a maintenance style basis is really helpful. And it's something that really most people can benefit from. The laser isn't something that we use as often in maintenance because fundamentally that's helping with tissue healing, and if you haven't really got an injury to heal, unless you're prone to developing specific problems, and as an example, a marathon runner who's prone to getting shin splits could potentially use the laser in their weeks leading up to the sort of the date. There's not really the need in other people to actually use that laser on a maintenance basis, so I don't tend to particularly use that unless I have a specific injury, for example. Finally, the spine adjusting, and that's just getting some of these little joints in the spine that maybe are prone to getting a little bit stiff because of the way in which we use our bodies, and getting those moving again. And that's just specific targeted bits of motion that just help keep all of these joints working in unison, rather than getting stiff hinge points that create problems and then result in symptoms and discomfort. So that's sort of how we approach maintenance treatment. It really helps. It's something we do on all of us here, and it's most likely something that you'll benefit from too, especially if you're stuck at a desk or if you regularly go to the gym and do particular sports. Thanks for watching. Thanks for taking time to watch our video today. Remember, for more videos like this, you can hit one of the buttons up here. For videos on our Back in Shape program so you can work out from home and protect your back, just click the button over here. And remember to stay up to date with all our videos, hit the subscribe button above my head. Thanks for watching.